Welcome to Medicine Handy Point. Aortic regurgitation is a topic for today. Some defining features are number one, wide pulse pressure. Number two, collapsing pulse, very important. Number three, early diastolic murmur, very important. And austent faint murmur. Now, austent faint murmur is actually caused by regurgitation of the blood in severe AR, causing closure of anterior mitral leaflet, producing mid or late diastolic murmur. So, what could be the causes for AR? It could be due to valve problem caused by rheumatic fever, infective endocarditis, bicuspid aortic valve, and also rheumatoid arthritis can cause valve problems. Due to aortic root dilatation can also cause AR. It can be caused by hypertension, syphilis, Marfan syndrome and Ehlers-Danlos syndrome can cause aortic root dilatation. Aortic dissection can cause it, and ankylosing spondylitis can also cause AR. Now, when it comes to surgery, so we do aortic wall replacement in symptomatic patient. In asymptomatic patient, we do it if there is depressed ejection fraction, and we also do in asymptomatic patient if left ventricular end diastolic diameter is more than 75 mm and left ventricular end systolic diameter is more than 55 mm, means left ventricular dilatation, so we do it. There are again two walls, mechanical wall, lifelong, no but anticoagulation. Biological valve 10 years duration but no anticoagulation. I hope you like the video and please subscribe.